Hello and welcome to Women's Football Hub. I am your host, Carolyn Kent, for this episode, and I am delighted to say that we are continuing our pelvic health series with a woman who works in both women's health and also has a master's in sports medicine, and she is also a co-director at the 360 Mama Ltd. Welcome to Women's Football Hub, Emma Bradley.
Thank you. Nice to be here.
It's very nice to have you, and I can't thank you enough for reaching out. And we were just kind of chatting before we came on air here about the pelvic health community and how great the evidence base is, and how unbelievably supportive everybody is in the sort of pelvic health community.
Yeah, I totally agree. Honestly, every time I go to an event or online events, basically the passion that everybody has for women's health, pelvic health is huge. And I think everyone's goal is just like to get the whole world to know about it, and to know that we, as pelvic health physios, exist, and like what is our role, and this is why you need to come and see us. So yeah, hopefully you're really helping with that.
Well, here's hoping, and I have to say I'm really excited to kind of listen to this, kind of have this conversation with you today, because the first thing we want to talk about really is pelvic health anatomy. So let's talk about the pelvic region and the anatomy in the pelvic region. What do kind of newly qualified professionals need to know if they're going to go in to work with female athletes?
I think probably the first thing to say is initially it can feel quite overwhelming. I remember that as sort of going into the world of pelvic health, having come from an MSK background, it sort of felt like, oh, this is the whole world of anatomy that I hadn't really been taught before, which now I think, gosh, that seems so silly, because I know how much the pelvic floor interacts and influences so many other parts of the musculoskeletal system. So I think probably I would break it down and say, keep it simple to begin with. I think it's important to sort of recognize that, first of all, the pelvic floor is a group of muscles. And certainly sort of when I'm talking to clients and patients, a lot of people have the impression that the pelvic floor is one muscle. And so when they're kind of imagining it, how it works, it's the idea that it's, one muscle squeezes, releases, and that's all that it does. But actually the pelvic floor as a whole is made up of several muscles. They all have their own different functions, and that is part of the kind of slightly more complicated nature of teaching pelvic floor activity, teaching pelvic floor rehabilitation, because it's often not just about a simple squeeze release. So the majority of the pelvic floor actually has posterior attachment points. So that's another kind of key point in how we teach pelvic floor exercises in our profession, is to always be asking the client to initiate an activation from the back passage and bring that activation forwards towards the front passage. Whereas a lot of the time, often people are under the impression it's sort of, oh, just imagine that you're stopping yourself from weeing, for example, which can bring on a pelvic floor activation, but often it can isolate that to very much that anterior portion, and that is a smaller portion of the whole pelvic floor in comparison to what we can achieve when we initiate from the posterior region. So I'd say that's probably quite a key point. Another thing is therefore how much the pelvic floor can influence the coccyx, with some of the muscles attaching directly onto it. So it's very common to be able to identify coccyx pain as being associated with pelvic health and pelvic floor dysfunction. Certainly from an MSK point of view, that's a problem that I would treat quite frequently with clients. And if you're not aware of the impact of the pelvic floor, you kind of don't know how that's anatomically affecting it. Often that's a big area of treatment that you're missing, and therefore also to kind of bring into that lower back pain is also then very often influenced by your pelvic floor, and we all know that's a huge area of practice and something that we see all the time. So I would also sort of be encouraging any new graduates to be thinking of including some form of pelvic assessment if that's presented to you.
So let's talk about that, because that's a nice kind of segue into the fact that the pelvic floor can be affected and is affected by really kind of a whole holistic set of systems. So for example, obviously you talked about the skeletal system there, but I believe there's also some kind of crossover with the digestive system and also the neurological system.
Yeah, the pelvic floor is quite an intuitive group of muscles, shall we say. So it's an area that is highly innervated. We know that, and that's often because of, the genitals are very highly innervated. If we kind of really go into anatomy, sort of when we think about that kind of homunculus idea within the brain, certainly the genitals are kind of a very big area within that. And so any kind of, trauma, it might be emotional, it might be just stress and fatigue, it may be, certainly if you want to talk about sort of the digestive system as well, other things that cause pressure within that area. So constipation is quite a big one to consider in terms of how that affects the pelvic floor. All of those things are likely to impact how your pelvic floor behaves. And for example, we do know that actually a large proportion of people with pelvic floor dysfunction do struggle with something called like overactivity within the pelvic floor, which means that actually there's sort of a constant underlying level of tension within those muscle groups, which is driven by another kind of systemic thing. So like you said, sort of from a neurological perspective, if you're somebody that typically clenches their jaw, grinds their teeth, gets tension headaches, have their shoulders up around their ears when they're stressed, that's a very similar kind of way of describing what can happen within the pelvic floor, in that we can kind of hold tension within that area, and it's a very common thing to occur. So in that sense, what we want to be really clear about is not always just assuming that if you've got pelvic floor symptoms that you should be doing repetitive Kegels and squeezes, which is, again, from a pelvic health perspective, that tends to be about the amount of pelvic floor understanding that we might have coming out of sort of an undergraduate level of training. But actually, by doing repetitive squeezes in a kind of patient group that has that overactivity, is likely to increase their symptoms further. So in pelvic health, I do internal assessments, and that's sort of like quite a niche area of training, but there are other ways of identifying whether you are likely to be struggling with overactivity. And so I'd probably say again that that's something that we would maybe want to be teaching a little bit more of, so that we can at least do the basics of identifying whether you might be in that camp or whether you might be in the camp that does need a lot of strength training before we jump in with a rehab program.
Right, and obviously you spoke about Kegels there, and I think a lot of people do kind of tend to associate, well, pelvic health, it's Kegels, and what you've basically said there is if somebody's already overactive and you then get them contracting a lot, it's obviously going to feed into that overactivity. Please correct me if that's wrong. You know, I think it also is a good reminder about everything that you've said there, that we, the psychosocial side of a patient, and just being holistic with them and looking at everything that is going on with regards to their life, and not basically bringing them down to, well, it's a pelvic floor problem. So take me back to athletes then. When you've got an athlete with a pelvic floor problem, what sort of things are they likely to experience?
I would say that's probably a bit dependent on their sport, for one thing. Just as an example, we do know there's quite a high prevalence of stress urinary incontinence in gymnasts, for example. And a lot of the time when you kind of track that back through their sort of historical training, which for most of them starts in childhood, a lot of the poses, a lot of the sort of language that is used around gymnastics training, if you're talking about kind of core strength, core work, a lot of the way in which that's coached and trained is like holding the tummy, or you're also got to be considering the outfits that they're wearing. So for a lot of those girls, particularly sort of as they go through a puberty phase, they're not necessarily wearing clothes that they're completely comfortable in. There's a little bit more of a tendency then to want to sort of hold in through the abdominal region, and we do know that that tends to mean that it increases the amount of intra-abdominal pressure. So if you're constantly holding in or tightening your core all the time, and you're not allowing it to kind of release and contract the way that we would want it to, then what you're doing is you're causing an increased amount of pressure around your midsection in the intra-abdominal space. the diaphragm that sits above it is such a firm, thick piece of anatomy that that pressure is not going to be directed upwards, also just because it's anti-gravity. So if we're creating that pressure around your midsection, it's likely to be then directed downwards. And the pelvic floor is sort of like then that last piece of the puzzle that's trying to control or support that additional pressure. So if you then add into it impact on top of that, or lots of repetitive impact in the cases of some sport, at some point the pelvic floor often just gets to a stage in which it can't support that additional pressure. It hasn't got the capacity to do that, and you may start to get symptoms like the incontinence, which is, like I said, in that sort of population, something where there's quite a high sort of reported incidence of. But that can apply to other sports as well, obviously. You then want to be considering, so something like a runner, for example. Obviously the way in which they're training, it's often very kind of one-legged, isn't it? So the motion of running is the landing on one leg and the swing through phase. So we then need to be considering, well, actually, is the pelvic floor functioning in a split stance? Is it able to support itself through a single leg impact, and then the power required for the push-off phase? So it is a bit sport dependent, but yeah, in athletes, you're probably looking at either incontinence issues, you may be looking at pelvic pain or hip pain, back pain, coccyx pain, that type of thing that's associated with it. Or yeah, those are probably the main issues.
Lovely. And I wrote a little blog recently, which basically speaks about, there's a screening tool that was released, I think, in 2022, 2023, and it's the PFD Sentinel. So if anybody is working in screening female athletes and thinking about pelvic health, there is a screening tool available for you. It was published in the British Journal of Sports Medicine. Head on over there and check that out. Now, I know the other area that you kind of specialise in is C-section scars and their impact on pelvic health. So chat to me about that.
Yeah, so I do a lot of work with postpartum women, and there's often always work to be done with the postpartum population, even when they're sort of fairly symptom free. Once you kind of go through a full assessment, there's often always things that do just need a little bit of work to improve upon. And what we're trying to do in that sense is actually kind of ready women for the rest of their life cycle as well. So like I said, it's not always about treating an immediate symptom at the time. It's about making sure that we're preparing them for changes that might occur at perimenopause, menopause, and beyond. And often the changes that occur as a result of pregnancy and birth are sort of the starting point to maybe seeing some changes within the pelvic floor. It's often also the time that women are suddenly aware of it, either because it's suddenly something that people talk about or because they are getting symptoms. So it may well be that until that point in their life cycle, they've never ever considered their pelvic floor, and then all of a sudden it seems like it's the most important thing in the world, and they're doing loads and loads of Kegels just to try to prevent anything from happening. And as I said earlier, that actually might not be what is required for them. When it comes to C-sections, I think the biggest kind of message that I would say is remember that it's major surgery. I think it is so normalized as a process. I think we also need to be really aware the C-section rates in the UK particularly are rising. I think that's also true in a lot of other places, but obviously my understanding of the UK is better. So we are seeing it a lot more frequently. Roughly only about 16% of the C-sections that occur yearly are elective, so the rest of them would be emergency C-sections, which often then has a real impact in your recovery, either because there's a huge psychological impact that occurs in that situation, or because it's not the birth experience that you hoped for or you wanted for, and you therefore have some negative associations with it. And a big impact of that is that women find it extremely difficult to engage with their scars at all. So they either don't like to look at them, they can't bear to touch them, they wouldn't like somebody else anywhere near them. And it means that we then have this kind of area of quite significant scarring that we completely avoid. And underneath those layers of scarring, so remember that we cut through 7 layers of tissue in in a normal C-section delivery. So that's all healing in its own way. And then underneath all of those areas, and also we cut through in a C-section the abdominal muscles, the pelvic floor attachment sites are often sort of close or underneath the pelvic, the C-section scar. And so that scarring can really impact the way in which that area of the body can function. And again, sometimes that's because people have completely dissociated with it. So it either feels completely numb to them to touch, or they don't touch or engage with it at all. So the expectation that it would suddenly function well in an athletic situation, or even if we're not talking about athletes, normal day-to-day activities as a mum, which all involves quite physical tasks, it's quite unlikely that that's all functioning really well beneath the scar. So a starting point is addressing the negative feelings, addressing the ability to engage with the scar, look at it, touch it, etc. And then beyond that, yes, there is lots of treatment that can be done regarding scar massage, abdominal work, pelvic floor work, internal pelvic floor treatment. But the starting point is often just education and helping women to understand that they do need to engage with a C-section scar.
Yeah, and I think that that for me is probably that take-home message. If we've got any listeners who've potentially thought to themselves after listening to you today, oh, I've got maybe some issues with my pelvic floor, or potentially some issues with my C-section scar, and they'd like to reach out to you, how can they do that?
So you can find me on almost every social media channel. The tagline is @the360mama, and I run that with my business partner, who is a scar massage therapist. We offer daily videos on all of those channels that hopefully help to educate women about common symptoms, things that they should expect as normal and shouldn't expect as normal, things that we would recommend that you do seek treatment for, and then signposting you to the correct professionals to do that. And also just starting to give you as much information so that you feel empowered to start treating and managing some of these things at home as well.
That sounds perfect. I think that's a good place to leave it for today. If you're working with female athletes, please train them hard, please train them well, but please also speak to them about their pelvic health. Emma, thank you very much for coming on. It's been great to talk to you.
Thanks for having me.
Thank you for listening to Women's Football Hub. The information within this podcast is for informational purposes only. No material on this podcast is intended to be a substitute for medical advice, diagnosis, or treatment. Please contact your doctor or another healthcare professional if you have any questions about anything raised in this podcast.